a few minutes or a minute or two to introduce themselves and tell us a little bit about what they do, and then we'll get into things. Dr. Abed, would you like to kick us off?
Sure, and always great to share a stage with two of my favorite peers in the industry. So, quick comment about myself. Some of you will have heard this before. I'm a medical doctor by background. About a decade ago, I left clinical practice, set up the Abed Group. I've been the director of cybersecurity services there ever since. We're all clinicians in my team. We work with big technology companies around the world, government agencies as well. I also hold multiple independent expert roles for the European Commission, World Health Organization, UK Infrastructure and Project Authority. And just to pick up on what Emmanuel was saying from ETP, also we have a great relationship with Cylera and IBM, with our own clinical security technology embedded. And I'm sure, offline, a lot more people will be interested in hearing about that. But I'm going to stop there and hand over to Shaun.
And Shaun, you work a lot better, or you sound a lot better without the mute button.
That's so typical, isn't it? That's so typical. Technology leader, yeah. Can't even unmute. Anyway, good afternoon. I'm assuming it's good afternoon there. It's good afternoon here in the UK. I'm Shaun van Niekerk, and I represent the other side of the fence, where Dr. Abed would be the clinician. I work in tech, so IT and of course cyber. I currently represent a local hospital, Dartford and Gravesham NHS Trust, and very recently, as actually of this week, I've taken on another two roles, whereas my current role is head of IT and cyber. So again, that's a privilege to own both and to have a skill set to manage both. A pretty tough job as it is. But fortunately, this week, the job got even harder, being able to be the head of cyber for another two hospitals in an adjacent county. So that's pretty exciting, getting to apply, all the skills across a patch of individuals. One could argue makes it a lot easier, a lot more difficult, but you're replicating your findings. It's not like you're reinventing the wheel. So yeah, so work at local level, obviously in the tech space. And, I know Emmanuel in the previous conversation, I'm probably going to reference him 2 or 3 times because I caught the last 5 minutes and there's a lot of similarities. And the interesting thing was about, what, we were talking about early on, prior to this call, I had 1 or 2 calls about, similar analogies that he was referring to, which I'll touch on in a bit. He spoke about, who was it, Muhammad Ali, but I'm going to tell you another sports analogy once we get deep into the conversation. So that's me, and that's what I do, and looking forward to today's session.
Great. Well, thank you both, Saif and Shaun, for joining us here today. And I think having two folks from the UK, and those of you who recognise my accent will probably know that I originated there, although I live the other side of the pond these days when I'm not sitting on an airplane, which has not happened much since March this year. Surprisingly, but there we go. So you have an all British, a British quad up here right now, I suppose, with Fulham as well. So let's talk about the nuances of healthcare. Let's talk about how perhaps the UK and the US system, because I know you both have experience on both sides of it, particularly Dr. Abed, on multiple healthcare systems in multiple countries. And let's talk about how do we get to a better solution where we're all talking the same language.
Yeah, I mean, if I can jump in immediately, when I was thinking about the title of this talk, I went between yes and no a lot. And the reason is because job titles for me are not things that I get hung up on. What's more important, I think, at the core of this is we have a challenge of making sure clinical leaders are talking to technology leaders and security leaders, as you say, sharing a language set, sharing the same mantra in terms of objectives that need to be achieved to make security projects successful and not just be perceived as technology projects, but be perceived as patient safety, clinical outcome, business continuity projects, essentially. And I think that's the position I start from before trying to determine, okay, do we need someone with job title X or Y?
Sure.
Yeah, I'm sorry. I absolutely in agreement with that. And this is probably where the analogy is going to come in. And it equates to sport, and it's normally going to equate to team sport, in the sense that you can give, a professional team, for example, you could give everybody a title, but the problem is you could take that title and move them into a different position. Does that make them more effective? It becomes this big game of you need a specific title, but to underpin, the specifics of what that role is meant to do. And I think that's one of the biggest challenges we have, which we're probably going to touch on in this conversation, I think in intricate detail, around how those roles are so pivotal. And this all stems down to leadership, because somebody needs to make the call about, these individuals delivering what they're tasked to do, for the very reason of why they would be selected in the first place. So yeah.
But isn't it one more of collaboration between people with levels of responsibility in the organization to ensure things get done and happen, more so than than titled roles, right? I mean, my title is this, I'm in charge of that sort of thing.
So I'll just jump in there. Yeah. So it's a difficult one, and we actually had for the audience, we had a good sort of discussion about this the other evening, touched on that, and post that conversation, I went out and I had this discussion with probably another 2 individuals around the specifics of job titles. Now, when I compare the US to the UK, I think, and it's debatable as to, my view, that I feel the US might be more established in some of those job roles or specialist job roles. But then again, one could point out the bigger the organization, maybe the more established those roles are. If you go to a small hospital with 30 beds, do they really have that level of structure or that kind of roles? And I know so far we're touching on a topic that sounds very generic about job titles, but it's actually quite important, because if you look at the UK and the way the NHS is structured, 1.6 million users and counting, the asset count is starting to shoot through the roof. Digital transformation is happening at a rate of knots. And, when everybody says, oh, things are less secure now than what they were probably 8-9 months ago, I can absolutely guarantee to say that things are happening too quick, that we're struggling to contain some of this stuff. So there's a lot of work required. But the problem is, if those eminent structures don't specifically cater for those functions that each person needs to serve. So go back to the professional team. Yes, if you were a Sunday league team, different story. But if you're a professional outfit, you can put a thin individual that's supposed to play, let's say, for example, if I used rugby as an example, maybe a bad example for the American colleagues, but just equate it to American football. Maybe the idea is you're not going to have a 3-foot thin individual playing quarterback, for example. They got to be built for that particular role. And it's the same thing with what we're doing in the NHS from a leadership structure. We need to envisage, or we need to ensure that from the top down, and the top down being that coach and his leader, for example, who might be the director for that particular sport, as a team, from the selectors, they need to choose the person with the right skills and the right qualifications to do those roles. And in the NHS, I'm not saying it's not about qualifications. Cyber is still relatively new, if you think about it. It's only in the last 2.5, possibly at most 3 years, that this has become a mainstream topic. Now it's like, how do you become the top of your sport when the sport had never been established or fully understood a mere 2 or 3 years ago? So you can see we've got a lot to do to try and turn that around, and to say from the top down, we've got these high level skills that person, for example, can understand risk, can decipher the risk, can report effectively. So in my view, UK wise, we're still wrestling with structure, to be honest with you, which is a detriment to actually trying to defend and to protect. So yeah, that's that's the observation. Lots of thought gone into that process. Hopefully, Dr. Saif sees that as the same challenge we face.
Yeah, I mean, one of the things, referencing our conversation from the other night, again, if I was being a cynic, I would say, what's the purpose of a new role or a new job title if you don't change the responsibility, the seat at the table, the autonomy of that role. Is the purpose of having a chief clinical cybersecurity officer to say, okay, well, the CISO and the existing CMIO don't have enough influence or enough of a relationship, so we need this new role. Well, at the end of the day, if that role doesn't have a seat at the table, doesn't get regular boardroom access, is still reporting to finance, for example, and is stuck at the end of the day trying to do balance sheet calculations rather than patient outcome, patient safety, business continuity justifications, then that role is going to hit the same challenges that all these other roles have. And so, my view is very much, it's about that team sport. Let's look at the roles we already have today. Are they in the in a steering group together? Are they let's make it less formal than that. Are they having coffee together or whatever beverage you so choose? I mean, I said this in a LinkedIn update. I said, if more people in hospitals or in technology companies had the relationship that Shaun, you and I have, you as a CISO, me as someone with a clinical background, a lot more would get done, irrespective of whether we have the requisite job titles. And I think that's really important. There's a fundamental culture shift that is happening. I don't say it hasn't started. I believe it has started. And I agree with Shaun in that whenever I'm working in the United States, I see the job title of CISO and other even more specialist titles like director of threat hunting in a hospital and all kinds of things, director of IoT. And we simply aren't seeing that in the NHS as it stands today. However, it does come back to that same point. I really see, apart from the title CISO, which I see more and more, I see the really specialist director titles are in your big flagship, very, very famous, I dare say, rich health systems. And you go to a hospital in the community, small number of beds, or even a small acute hospital. And you know what? They're challenged. They don't have those roles as much. They're struggling to get the funding, but they know their problems that exist, and they're trying to figure out, how do I build a team to address this? The people and process component before I can even get to the technology. So there's a lot there to unpick, I think, before we can even get to a job title.
Absolutely. And, I was just thinking about this morning as well, is, you've got this very progressive workload that you're trying to drive. Okay. And you can be as passionate as you want. You can be as connected as you want. If you're not going to get buy-in within your organization, it's going to be difficult to move that kind of agenda forward. So sometimes you wonder with how quickly, and I think you might have mentioned this, it was something to do with the attacker disparage. What was the term you used, Dr. Saif? Your terminology?
Yeah. So the gap between digital and security maturity, I call it the attacker's arbitrage.
Arbitrage, that's the one, yeah. And that is pretty much exactly what's happening, where you could see digital maturity obviously gain up at a rate of knots. Unfortunately, the cyber maturity is still lagging behind, purely in my view, not because of the technology that's there. I can do any business case to get any solution I really wanted to. The problem is, unless I get the entire organization from medical physics to, and Manuel spoke about IoT, and a question was posed to him about OT as well. Exactly the same thing, with medical gases running through the building, sensors, monitors, fridge monitors in pathology. I can go through the myriad of devices that make an acute hospital such a complicated environment. The problem, though, is if you do not have high-level visibility of all these things with support. And this goes back to one illustration which we've seen so many times on LinkedIn, which I think is an app, but I'm going to extend it now. And that is, you've got all the adults sitting at the board, sitting at their table. You've got the kids sitting at the kids' table, of which the cyber individual is sitting there as well. So cybersecurity represented at the kids' table. And then I think I even saw this a good number of years ago, probably 3 years ago, where that illustration shows an exec walking up and saying, listen, it's time for you to join the adults table. Now, I'm going to say that hasn't happened in the NHS, but I'm going to go a step further and say that a lot of the chief information officers, take note, there's a chief in the title, are still not represented on the board. So how, when you have your board meetings, you only get a short time in a month. How do you get the message across of what the risk really is? So again, a lot of us banging the drum trying to change this, not trying to be adversarial, just we know what the real world looks like. All you have to do is look at how the APTs are growing and what they're actually doing. And if you pay attention to that, our structures need to evolve. But to do that at a local level, because you might get a hospital that decides, we're going to go down that route, we will restructure to address this new world order. And that's fine. But when you're 630 organizations equivalent across the NHS, well, you're going to need help from a central authority or a central body to drive what this new world should look like. And that's my view. Once you've got that right, we can start moving on to other pressing topics to drive the agenda forward. So I still feel now in my role and all my colleagues' roles, we're still working a bottom-up approach.
I would agree with you. I would agree with you. But one of the critical success factors of cybersecurity enablement in any organization is the establishment and sponsorship of the cybersecurity program, right? And that needs to start at the top and to percolate down. So it needs to be, the Minister of Health that says cybersecurity is a priority for us in healthcare, right? Or the CEO of the hospital system, or the chairman of the board, right? That says cybersecurity is important to us in this hospital, in this health system, and therefore we need to establish that culture that permeates all areas of the organization. My question to you is, do we have sufficient language? Do we have sufficient institutional knowledge on the clinical side of the business to understand the terminology and the risks that are being posed on the technical side of the business? Or are we talking different languages here?
So I want to jump in. I want to be controversial straight away. And I'm going to say, if I'm a clinician, I don't care about your technical language. I don't care about your financial language. I'm busy in the emergency room right now. I'm busy in theater. I've got X number of patients who need an angioplasty, X, Y, Z. Yes, I also happen to be the CMIO, but I'm busy with the digital transformation program implementing our EMR solution, which I've just about got to grips with. And that's kind of a big reality of it. And so that's me being a cynic here, right? But I would say, therefore, the challenge becomes not speaking technical whatsoever to get a clinical audience on board, especially if they're time pressed. It's about looking at the data that you understand really well, that's technical, and translating it into a language that makes sense to them. So it's, for example, saying, okay, I have a bunch of vulnerabilities and a bunch of threat intel, but what that means to the head of radiology is, look, if this stuff kicks in, and we don't resolve your, update your PAC system or update, whatever it is with your CT scanner, it's not about taking down your machine for a couple of hours to update it, or hopefully not that much longer. It's about losing access to PACS for a week and throwing the entire hospital system, all the clinical workflows out the window, losing revenue. It's about putting that in that language, and not to digress too much, obviously, in our work, we subdivide risk into clinical, organizational, financial, and regulatory and reputational themes. We've automated that, great relationship with Cylera and IBM in terms of using that. But for me, it's all about framing risk with the right language and not expecting others necessarily to have the time or the inclination to learn your language. And that's just the harsh reality of how busy healthcare is.
So to come back to my earlier point about roles and titles, do we need someone who is given the title of clinical cybersecurity safety officer in order to press that common language through, to translate, to act as that gateway, to translate the technical language that Shaun and his team will come up with through to the doctors that you and your team will speak the language that they will speak?
Well, I'd say, before I hand over to Shaun, there's a psychology to this. If someone has already said they want to be the CMIO or the CNIO, I think we should redevelop that role to include security as part of the curriculum and expectation of that role, so that people know from an early stage, if I sign up for this, this is part of my portfolio, and I will need a certain baseline level of, if not immediate knowledge, I'll need a baseline level of engagement with the people who can educate me about this in the organization. I know, Shaun, you've mentioned, there have been clinicians who've approached you saying, Shaun, I want to work with you and learn more about cyber. Well, how do we incentivize more clinicians, or the one clinician who has an IT leadership role, to want to approach you and other CISOs to have that conversation? And similarly, I think this is both, historically, it's been the CIO and now the CISO. We should create a more comfortable environment. I mean, I've spoken to CIOs back in the day who don't want to talk with the professor of vascular surgery, happens to be the CMIO, because he's seen as kind of this godlike, intimidating figure in an organization. So how do we get them to socialize more often, where a CISO can say, look, this is what we need to do with the following systems. We want to talk to you about it. We don't want to cause you disruption. Actually, we want you to help work with us to make this a seamless process so that we can upgrade everything and get into an even better position. How do we create that comfort and familiarity, I think, is another part of the equation.
Yeah, from my perspective, I'm still trying to unpick some of that stuff. This morning, I had a conversation with somebody who was actually is actually the national lead for one of our information governance groups. And apparently, a lot of the questions that they're starting to get now is there seems to be disparity between what the information governance is needing to do in the new world around cyber. So you know what a CISO is capable of. There was an amazing illustration posted not so long ago of what a CISO actually does. And I actually requested if I could use or reproduce that illustration. And unfortunately, I got, in a very nice way, no, you can't. But the reality is I printed that off, I put it on my wall. And this is the kind of thing that I've disseminated in all my, not just talks, but in all my forums that I represent. And the reason is trying to get the message across. So it's not a case of the original information governance role is becoming, yeah, I was going to say misused, but in a sense, the role is not redundant. In actual fact, it's just going to elevate those individuals because they're going to need to do a lot more to support both the trust, leadership team as well as the CISO, assuming they can get the CISO in post. And I mean, there's about 3 or 4 job titles that they need to spin around. But put it this way, that means we talk about cultural change, and it goes back to, we've got stuff called systems managers. Okay, so if you went to a department like radiology, or if you went to cardiology, some of these systems have 10, 12, 15 different systems sitting on 20, 30, 40, virtual machines. So the problem is it's very difficult for an IT engineer to know that system back to front because it's normally going to be a specific specialist that will know more. But the thing that we find when we go back to this thing about getting the roles or the structures right is, and something that I've learned over time, nobody's telling those individuals how to evolve their roles with this new world order of IT and cyber from a maturity point of view, from a management point of view, from a patient safety point of view. And I can name several examples where I see this. And again, none of them will contest that, that statement. And the reason is it's now going back to the board and saying, cool, this is what we really need to do. So put it this way, we know what to do. We're just struggling to get it done because we need to do it at a national level, not necessarily a local level. It's like if you define the rules of engagement at a national level, it's so much easier. And I think in a sense, what we tend to do is in a lot of our forums is we try and drive that change so that we can get that type of reaction and that type of support at a national level. Does that make sense? I know it sounds a bit generic, the fact that we now, 3 years since WannaCry, and we're still talking about job roles, job specialties, titles. I still think we've got a couple of barriers to overcome. But I honestly believe once we do overcome them, we will flourish. The floodgates will open. We will achieve, I reckon, at a rate of 3 to 4 times more in terms of what we're currently achieving at the moment, even though we're making significant progress.
Yeah, I think the lag from WannaCry is a big concern. I mean, we all know how badly the NHS was hit by WannaCry. But there's, if I look at that on a global scale, there's a lot of hospital systems that are being hit by ransomware on a weekly basis across the world right now. It's a very lucrative target, and we're all playing catch up, right?
It is, Richard. And then also just touch on something of why, going back to those roles and structures, rather maybe they're not job titles, but it's what the person's function. You brought into the team to do a specific function. You've got a key role. If you don't perform, you let the side down, and put it this way, you incur more risk, and odds are you're going to lose. Okay, that's how you would put it in sports terms. Or you could turn this around and say be less competitive. In a hospital terms, it will be, well, you might compromise more patients and more patient care. So I think that's quite pivotal. But going back to some of those roles, I feel like even if we start talking about some of the medical device stuff, and those systems managers, that you need somebody to say, look, that's what you've been doing for 3 years. There's another 10% that we now need to add on for you to help drive a, systems maturity or whatever it might be. And, I think we are making progress, but I still think we've got a long way to go that everybody speaks that common language.
Yeah. And I think that's key. It's speaking that common language. And, it comes down to collaboration, right? Getting the message out and reinforcing that message, across every layer of the organization so that, when something hinky goes wrong with a piece of technology in the operating theater, the doctors and nurses know what to look for, rather than just to assume that if that piece of material, that piece of equipment is functioning correctly. They need to be able to challenge that and say, is this perhaps under cyber attack? Has it failed? Is it working abnormally? Is there something that, I, in my role, need to consider in my evaluation of the current situation? So.
Yeah, I mean, I just want to jump in and add, like, what I think is really important, and I think I've said this a few times already, and I don't want to sound too much like a broken record, but it's important that we start contextualizing the language of cybersecurity in the language in a clinical outcomes language. The mantra at my company is cybersecurity is patient safety. And I say that because everything should be measurable in that context. Now, yes, certain stakeholders may be interested more in financial and regulatory outcomes, but at the end of the day, without that shift in emphasis, you won't get the buy-in that you need from clinical leadership, but also actually, I dare say, in the boardroom. In the boardroom, everyone understands what patient safety and clinical outcomes are. They might reframe it a little bit in each of their minds. They might take it and think about, oh, what reputational damage will I face if patient safety is compromised? That might be their end goal, but everyone understands patient safety, whereas they're not going to necessarily understand CVSS or anything like that. And I think that's a really important bridge that we need to cross. Whether we need an additional role with a new job title to do that, I think continues to be up for debate.
Right. Yeah, very, very good points. Very good points. But I think we're coming up at the top of the hour, so I'd like to thank Shaun and Saif for sharing their expertise, knowledge, and taking precious time out of their day, dealing with the day-to-day run-of-the-mill issues of managing healthcare. So thank you very much.
Thanks a lot. Cheers, Richard.
Thanks very much. I found the clap function, so we can do that. Thanks. Nice to see you again as well. It's been a great discussion. I look forward to seeing you in the audience.
Thank you.
Thank you.
Brilliant, Richard. Well, I think we're off to a flying start. We got some very nice comments in the audience. A lot of discussion about IT/OT convergence. It seems to be the hot topic, not just in the healthcare space, but in the whole MSS space. Would you like to introduce our next speaker?
Absolutely, absolutely. Yeah, I was following some of those comments as